Here in Glasgow City, we want to tell you a bit about the work that we're doing for people who are the most vulnerable in our society in terms of their drug addiction. Before we do that, I want to talk to you a bit about where we see the work that we're doing with people who are affected by addiction. We have really good mainstream health and social care addiction services, working with the third sector, and we have hugely successful recovery communities, but we know we're not getting to our most vulnerable drug users. So I'm going to tell you a bit about what we're doing in relation to that. But we also need to be clear that the work we're doing with those vulnerable drug users are also looking at a range of other issues that they have in their lives and the things that we need to do to work alongside them so that they can become part of our mainstream society here in Glasgow City. We have a vibrant, fabulous city which we're hugely proud of, and the work that we want to do with the people who are most vulnerable are about how they contribute to our city and how our city best supports them.
We have a significant public injecting problem in Glasgow City. In November we had 613 unique individuals that used one or more of our IEP outlets, so our needle exchange outlets within the heart of the city centre. So we estimate there are around 400 to 500 people who frequently prepare and inject their drugs in the city centre. And we've responded to that population fairly well, I think. And again, if you look at November, and we gave out 25,000 needles or sheets of foil over a 1 month period. We have some of the best needle exchange services in the world. The range of injecting equipment that we give out is really second to none. And we can provide the best harm reduction advice and information in the world. But if people are taking that equipment, they get into the city centre, they're preparing and injecting their drugs in often dark, dingy, sometimes urine-soaked alleyways. You know, it's not hard to see why we're seeing so many complications. The complications we're seeing, some of the injecting-related complications we're seeing, such as infections and abscesses and ulcers, are incredibly severe. Drug deaths, we have around a third of the drug deaths that happen in Scotland happen in the Glasgow City boundary. One of the biggest problems we're seeing just now is the current outbreak of HIV. Around 170 people are found to be HIV positive, and that's an outbreak that started and was confined for a while, mainly to the city centre. What's driving the current outbreak of HIV is people directly sharing needles and syringes. There is no doubt in that at all, and we're finding that a really hard behaviour to change, certainly for a core of that population. It's because they'll be sharing drugs with people, and that equipment that's used to share the drugs is also the same equipment that's used to inject. And if a needle has been used before, then that risk increases significantly. I have to say as well, it's very, very difficult for us to influence somebody's injecting behaviour if you're not actually there at the point people are preparing and injecting their drugs. So this is a new test we're introducing. It's a rapid test for HIV. Within 5 to 10 minutes of taking this sample, we can establish if the person is HIV positive or HIV negative. If it's HIV positive, they can link in with treatment straight away. If it's HIV negative, then we can introduce a whole range of harm reduction measures to hopefully keep them that way. We decided to invest in a mobile IEP van, and the idea was to site it as close to Central Station as possible, covering that period between 6 o'clock in the evening and 10 o'clock in the evening.
Well, the mobile needle exchange van, which we're on at the moment, is absolutely invaluable in engaging patients because it's been proven that outreach to the more vulnerable, chaotic patients in Glasgow has had really positive outcomes. So it's been invaluable in engaging those patients because they've got somewhere to go when the normal pharmacies close at 5:30 and stuff, and it's a city centre location for them to get their equipment from, so it's been great. Cocaine's a massive issue. I've seen lots of major damage from cocaine injecting, so a lot of the injuries that we're seeing are a lot worse. I've dealt with numerous wounds where there have been infestation of maggots, so obviously that has to be cleared out before you can even attempt to get any level of healing. But if it was safer consumption and people are able to do something as basic as wash your hands, clean the sites before you inject, know that you've got a constant supply of needles, you've got staff there who can support you. One of the main dangers that we see as well is the possibility of sepsis developing, and that would be another thing. People would be able to be observed to see any possible signs or symptoms of that developing. Sepsis obviously is a fatal situation to develop if it's not, if it doesn't have the proper intervention, the appropriate intervention at the right time.
This is the first heroin assisted treatment service in Scotland. The medical prescribers in this service are the first licensed prescribers for heroin in Scotland. So we're very excited about it. We're delighted to have the bespoke state-of-the-art facilities that we do, which will allow us to deliver very high quality of service here. The service aims to engage with about 20 individuals in the first year and hopefully up to 40 by the end of the second year. These are some of the most complex drug users in the city with some of the highest drug-related harms. So these are early days, but we feel that our experience so far has been very positive, and we hope to build on that as the weeks and months go on. So our patients are expected to arrive in the morning and then the early afternoon for the injectable diamorphine, which is pharmaceutical grade heroin. So heroin-assisted treatment itself is an evidence-based treatment for people who haven't benefited from other treatments for their addictions. And one of the benefits is a reduction in harms experienced in relation to their drug use. And that's really because people reduce their street drug use as they engage with this treatment. But while they're here, we're also able to promote harm reduction practice in terms of safer injecting practice, transitioning from injecting to maybe less risky forms of drug use, and we're obviously able to supply people with Naloxone.
Well, the take-home Naloxone programme in Glasgow started way back in 2006 when we first piloted that. And what we have is quite a comprehensive supply route for take-home Naloxone. Naloxone reverses the effects of opiate overdose, so that's heroin or methadone. We train people who are at risk of overdose, we train family members and groups of hostels, for example. So anyone who's in contact, who's likely to encounter an overdose, has access to Naloxone. In Glasgow we have a widespread programme. I should say it's not the answer to everything, but our drug deaths are really high, but they would be even higher if we didn't have a Naloxone programme.
We have a number of large public injecting sites dotted round about or in the heart of the city centre, and every now and again those sites will be discovered and they'll be fenced off or they'll be closed down, and that in a lot of respects actually causes us more problems. Then disperses that population further into the heart of the communities. We have around 30 to 40 complaints by the general public every month surrounding discarded needles.
We'd like to see the implementation of a safer drug consumption facility as well. Heroin-assisted treatment service will perhaps reach 40 individuals, but we think there are up to 500 to 600 high-risk, vulnerable, complex needs drug users in Glasgow city centre, and a safer drug consumption facility would reach far higher number of those and would help reduce harms in that population very effectively. One of the key differences between a heroin-assisted treatment service such as this and a safer drug consumption facility is, of course, the legal status of these services. So a heroin-assisted treatment service is permissible. It requires licensing for the premises and licensing for the doctors involved. But a safer drug consumption facility at the moment would not be legal, and that's why we require a legal framework in order for us to be able to safely deliver such a service. So there are a number of safer drug consumption facilities across the world. I think the number is now more than 100 across the world. They have been implemented for decades in certain parts of the world. In Switzerland, which pioneered a safer drug consumption facility. The evidence seems to suggest that they're very successful in engaging the high-risk, at-risk population. The evidence suggests that they reduce the drug-related harms in that population. They have a role in reducing bloodborne virus transmission and drug-related deaths as well. As part of a wider system of care, the evidence suggests that they really reduce the extent of public injecting in the vicinity of such a facility.
Back to 2000, we had 23 deaths through Clostridium novae. In 2009, we had 9 deaths related to anthrax. In 2015, we had an outbreak of botulism. Over 30 people were hospitalised with that. The prevalence of hepatitis C throughout that period has been as high as 70%, and we're currently dealing with an outbreak of HIV. And we estimate around 170 people are now HIV positive from this one outbreak.
As a response to the public health emergency around drug-related deaths and the HIV outbreak in Glasgow, the city really needs a safer drug consumption facility as a key part of its response.